Welcome to ICU Primary Prepcast.
Hi, I'm Maddie.
Hi, I'm Swapnil, and today we are joined by our third host, Dr. Mike Clifford from Melbourne. Welcome, Mike.
Welcome. Thank you very much for having me, guys. Very privileged to be part of your 50th podcast.
Thanks, Mike. So obviously, as Mike said, this is our very special episode, and also this is our last episode of 2021. This is our 50th episode of ICU Primary Prepcast. So obviously, it's quite emotional episode, I guess. We started this journey almost 2.5 years ago. And thanks to Mike for joining halfway through when Maddie was preparing for her exams. And he helped us to get to this landmark. So special thanks to you, Mike, and also to all listeners who made this podcast very successful. And last but not the least, Maddie, who is the backbone of this podcast, who's been writing all the scripts for almost all the episodes so far. So Maddie, thanks a lot. Mike and Maddie, before we dive into this 50th episode, what's up for the Christmas? Any special plans?
My sister's in town from America. So my sister and brother-in-law. So that's been very exciting. So we did a family Christmas yesterday outside, which was really nice. And unfortunately, I'm working nights over Christmas, but I'm counting down because potentially this is my second last set of nights before, hopefully for forever.
And Mike, what about you?
Well, we've got Christmas Day coming up, so we'll be making a fair bit of food for that. I've got my 2 grown-up children and my 1 to negotiate this Christmas period. And then hopefully, if everyone can stay COVID negative, we'll be able to get away for a week. Curiously, I'll have escaped nights. I'll be taking my two grown-up children. One of them just finished school, so we'll be spending a bit of time with some friends down the coast.
Everybody's looking forward to Christmas celebrations and also celebrating the new year. And hopefully this COVID thing will be over in 2022. Who knows? Today we have chosen Christmas special theme. So Maddie got a scenario for you, Mike.
Yeah, so thought we'd focus in on Santa today.
Okay.
And we know that Santa, he normally lives in the North Pole, but has to travel all around the world to different environments. With different weather and places that are both hotter and colder than what he's used to. So, Mike, I was wondering if you could tell me a bit about how he maintains a normal temperature while he's traversing throughout the globe.
Yes. Okay. Well, we might consider Santa one of the extreme ICU environments, if you like. He's probably got a little bit of special Santa properties that are helping him. And I was thinking about how Santa might have some special colligative properties because he would need to have an amount of Santa magic that prevents him freezing. So he'd have to have some freezing point depression. It's important that he doesn't freeze in the sleigh when he's floating around. He would have to have boiling point elevation because as he's going in the chimney, the temperatures would get pretty high and we wouldn't want him roasting. His osmotic pressure would have to be fairly high because he would be consuming so many cookies and milk that if he absorbed too much water in a hurry, he'd get into trouble. And obviously, he would have a lowered vapor pressure, limiting the vaporization of all the alcohol that he consumes because you don't often smell an alcoholic Santa. So apart from his specific Santa special colligative properties, he would have very similar temperature regulation to most other non-magical human folk. And that would be keeping himself within a fairly narrow range of temperature. So all human beings have a sort of a threshold temperature within which they maintain normality, and it's somewhere 37 plus or minus 0.2 degrees. Now, that can be a little bit different depending on your age and certainly over a menstrual cycle, and women will be up to half a degree hotter when they ovulate. But that's the sort of temperature which our body uses as its range of normal temperature. We actually have a thermoneutral zone, which is a zone of temperature between which no metabolic rate increase is used to either increase or lose temperature. And that's quite narrow too. And in a naked 70 kilogram adult, it's 27 to 31 degrees. So if you're below 27 degrees, you'll start to use autoregulatory methods to maintain your temperature. And if you're above 31 degrees, you'll start to actively lose heat into the environment. Now, we don't often have a naked Santa, fortunately. No one wants to see that in a Speedo. So he would usually have a range of temperature that's 22 to 28 degrees would be his range, fully clothed. I like to think about the caveman standing at the door of the cave with his face to the fire and his back to the snow. And that reminds me that the anterior part of the hypothalamus is important for warmth reception, and the posterior part of the hypothalamus is for cold reception. And you use your peripheral Krauss receptors for the cold. You can imagine a German soldier on the Eastern Front in winter, and you use your Ruffini receptors for your warm Italian summer. So ways of remembering which peripheral receptors feed back into your hypothalamus and which parts of your hypothalamus modulate temperature control, but it's all managed through that preoptic area of the hypothalamus. Now, we use the sympathetic nervous system to modulate heat loss, and the reduction in sympathetic outflow to your skin blood vessels enables you to vasodilate, and that massively increases the flow of blood to the skin from a level of nutritive flow, which is about 100 to 200 mils a minute, all the way up to 8,000 mils a minute when you're fully vasodilating during exercise. So there's this enormous range of blood flow to the skin to facilitate heat loss through both convection, conduction, but mainly evaporation. And you can lose several litres a day to maintain your heat loss. And obviously the reverse of that, the vasoconstriction, is one way of mediating heat gain. So if Santa's stuck in the chimney, he would be massively vasodilated and sweating and trying to get slippery so he can get out through the chimney. And once he's upstairs out of the chimney onto the sleigh and he's off with his reindeer getting cold again, he would have to undergo fairly significant vasoconstriction. As an adult male, even if he's somewhat elderly, he would be able to have shivering thermogenesis. So he would have sort of large muscle cycles activated in his via his alpha motor neurons, causing somewhat incoordinate muscle activity, but also slow cycles between those. And at worst, if he was really cold, he might have rigors, which are very regular contractions of his extensor and anti-gravity muscles. But he would also be using some of his brown fat. He may not have a great deal of brown fat. Most of his fat would probably be yellow, although perhaps over time, over many thousands of years, he would be all brown fat. If we cut Santa open, he would have fairly dense, mitochondrially rich fat tissue, beta-3 receptors coating them, and he would be able to generate a whole lot of non-shivering thermogenesis to maintain his temperature when he's at altitude, traveling fast in very cold air.
That's great, Mike. And you mentioned brown fat, which is something we think of a lot in neonates, and we don't know a lot about what Santa was, where he came from or what he was like as a child or a baby. But if there was, for example, a baby Santa, can you briefly tell us a bit about how thermoregulation might be a bit different in a baby Santa?
Well, in a baby Santa, the body surface area to mass is greater, so he becomes even more round than normal, with a greater head area that's no longer warmed by a thick woolly beard. So his capacity for heat loss is much greater. And also neonates can't crawl away and wrap themselves in a Santa suit, so their ability to lose heat is quite significant. And what has happened over time is that we've evolved to have brown fat, which is these mitochondrially rich fat adipose cells with the capacity to rapidly cycle triglycerides into fatty acids and therefore consume ATP into ADP and generate heat, sort of non-oxidative phosphorylation that generates heat as a byproduct. And in neonates, that brown fat is in largely the interscapular area, the neck, around the thymus, down around the kidneys, perinephric region, around the abdominal viscera, so that core part of little baby Santa was wrapped in this very energetically dense tissue so that he could heat himself up at will, even in the North Pole.
Okay, great. So we might move on to the next section of the Viva.
Okay, so this is now Santa's come down the chimney, and he's managed to make his way into the ICU looking for someone to give presents to. And is it you he meets, Swapnil, who's going to measure his temperature? And how are you going to do that?
That's right, Mike. So Santa has to pass the COVID test before he enters the Australian ICU. So obviously at the door, we check temperature for every single person, and Santa is not an exception for that. So obviously the thermometers we use to check temperature nowadays, they are electronic thermometers. But I thought I might cover the wide range of other thermometers and how actually thermometers measure temperatures in human beings. So there are three different types of thermometers. So one is which is very commonly known and the most initially developed thermometers were the liquid thermometers. And here what we do is the thermometer measures a temperature through a glass tube, which is sealed with a mercury that expands or contracts as the temperature rises or falls. The tiny size of the bulb and microfine size of the tube help the mercury to reach the temperature of what it is measuring very rapidly. Now, the classic thermometer that we've seen in GP clinic in the past, they are called as bulb thermometers, which basically follow a simple principle that liquid change their volumes relative to their temperature. So as the temperature rises, the mercury-filled bulb expands into a capillary tube. Its rate of expansion is calibrated on the glass scale. And there are two different scales that we usually found on thermometers. One is the Fahrenheit scale and the second is the Celsius scale. A little bit of history about why these two scales differ from each other. So with the Fahrenheit scale, it was invented by Daniel Fahrenheit, who was a Polish physicist. He decided that the freezing and boiling points of the water would be separated by 180 degrees. And he paged freezing water at 32 degrees. This is what he thought. And then, so he made a thermometer, stuck it in a freezing water, and marked that level of mercury on the glass as 32 degrees. Then he stuck the same thermometer in the boiling water and marked it as 212 degrees. And then he put 180 evenly spaced marks between these 2 points. And that's how the Fahrenheit scale was developed. On the contrary, in Celsius scales, which was developed by German physicists and Celsius, decided that the freezing and boiling points of the water would be separated by 100 degrees. And then he made the freezing point of water at 100 degrees. So that's why you see the different scales, but they are linearly related. Now, some people might ask why we use mercury, or is there another liquid agent that we can use in thermometers? And the answer to that, yes, not all liquid thermometers use mercury. The reason being mercury can be toxic, especially if the thermometer breaks and mercury spills over, it can be extremely toxic and poisonous. And also the mercury thermometer has a limitation because mercury, for instance, becomes solid at minus 38 degrees Celsius. So obviously mercury thermometers cannot measure temperatures below that temperature. So the other liquid agent that we can use in thermometer is alcohol, and which is far more like safer than mercury. And it also can be used to measure lower temperatures. However, the drawback with the alcohol is, as you all know, ethanol boil at about 78 degrees Celsius. So obviously with alcohol thermometers, we cannot measure temperature anything more than 78 degrees Celsius. Now, moving on to the second type of thermometers that Santa might ask you to use during the Christmas at your home are the dial thermometers. Baking cake, you use the thermometer to measure the temperature of the cake or in the oven. They are basically the bimetallic strip thermometers. The principle is the hotter the temperature, the more the bimetallic strip expands and more it pushes the pointer up the scale. Now, obviously, we have moved away from bulb thermometers or dial thermometers in the healthcare setting. And now what we commonly use in healthcare settings, or what Santa will experience now in every single ICU or at the doorstep of every hospital, is the electronic thermometer. Now, the reason we moved from mercury or liquid thermometers or dial thermometers, because these thermometers take a while to react to a temperature change, while the electronic thermometers don't have that problem and they display the accurate results within fraction of seconds. Now, they work in an entirely different way to mechanical thermometers. They are based on the idea that the resistance of a piece of metal changes as the temperature changes. So as the metal gets hotter, the atoms vibrate more inside them, and then it makes harder for the electricity to flow, and that's why the resistance increases. And similarly, as metals cool down, the electrons move more freely and the resistance goes down. As the resistance changes, the voltage across this metal probe changes. And then obviously that voltage change is displayed as a change in temperature, because there's a microchip inside the thermometer which measures this resistance and converts it into the measurement of temperature. So the precise electrical thermometers, also known as resistance thermometers, and this is another trivia question from the primary point of view, where we see the another use of Wheatstone bridge. So the resistance thermometer use 4 resistors arranged in a diamond-shaped circuit, as we've seen in the arterial pressure transducer on Wheatstone bridge. And if 3 of the resistors have known values, the resistance of the 4th can be calculated. So if the 4th resistor is designed in the shape of a temperature probe, a circuit like this can be used as a very precise thermometer, calculating its resistance from the voltage and current, and thus allows us to calculate its temperature. So this is another use of Wheatstone bridge in intensive care unit inside the electronic thermometers. Now, there are other few different types of thermometers. These are obviously not used in healthcare settings, but when you might go one day as an intensivist in space with Santa, then you might travel with astronaut. And astronauts use infrared thermometers, while the athletic trainers, they use pill thermometers. And the pill thermometer transmit information about the body's core temperature for almost 18 to 30 hours. And they use liquid crystals to track changes in body heat and transmit radio waves to a source which is outside the body. And that displays the data of athletes' core temperatures. All these thermometers that we use are not accurate at extreme temperatures. So obviously, if Santa travels back to North Pole, or if he goes to visit Perth, obviously this thermometer won't be useful. In that case, we have to use something called a spirometer, a kind of a thermometer that reduces the temperature of an object from the electromagnetic radiation. So obviously, Santa might have to carry pyrometer to measure the temperature changes that he's going to face when he's traveling around. Now, some people have asked about the conversion between the Celsius and Fahrenheit. And Santa might have to know this because he might be traveling to different countries, and different countries use different temperature measurement scales. Now, the simple way to convert a Celsius temperature to Fahrenheit is you multiply by 1.8 and then you add 32. So that's the simple way of measurement. Or the other way to remember is every rise of temperature that adds another 10 degrees Celsius adds another 18 degrees of Fahrenheit. There are a few different scales that are used to measure temperature. One is the Fahrenheit and Celsius that we discussed. The third scale is the Kelvin scale, which is defined according to the triple point of water. And then usually it's not measured in degrees, but it's measured in Kelvin or capital K. And 0 degrees Celsius is equal to 273.16 K. So the trivia for question for you guys, because you keep asking me questions, so I thought I will take this opportunity to ask you guys question. Where is the world's largest thermometer located?
The world's largest thermometer?
Yeah.
Sweden.
Greenwich.
Wrong. Completely wrong. I knew that. I'm going to win this. So this is located outside Las Vegas. And this largest thermometer actually is 134 feet high. And it basically kind of created to commemorate the highest temperature ever recorded in North America, which was 134 degree Fahrenheit. And this temperature was measured in Death Valley in 1934. So anyways.
Oh, we should have known. There's a lot of upsized things in America.
That's right. Everything is big in America.
I hope it's still working, because they may need it in a couple of years when it gets even hotter. They may set a new record out.
That's right. So the answer is Santa is going to get his temperature checked via electronic thermometer. Yeah. So let's move on to the third part of this podcast. That is, now the Santa is going to go back to North Pole, Maddie. And as you all know, North Pole is quite cold. So what are the physiological changes that Santa has to face when he goes back to his North Pole residence?
So Mike's discussed thermoregulation, and we know Santa must have pretty good thermoregulation in terms of going through all these different environments. But let's say that he does get to the North Pole, and then some of these behaviors and his normal physiology is impaired, such that he suffers from hypothermia. So maybe he's had too much, Christmas pudding and mulled wine, and he's not himself. He forgot to put on his Santa suit and then stayed out in the North Pole. And some of the effects that we might see in that case is, from a neurological perspective, his usual, sharp mind and his ability to remember who's been naughty and nice, that will be all impaired. He'll have a progressive deterioration in his neurological activity. So he'll have disorientation, confusion, and eventually, depending on the extent of his hypothermia, it would progress to a coma. He would also be less likely to have seizures during this time because there's a decreased release of excitatory neurotransmitters. So this is one of the physiological rationales whereby people think that hypothermia might have been useful in things like status epilepticus, which obviously trials haven't supported, but he would have a less risk of seizure activity. He'd also be hyporeflexic if we were going to check his reflexes. And if his temperature was less than 30 degrees, we might see that his pupils were fixed and mid-sized or dilated. And he had loss of his ocular reflexes. From a cardiovascular perspective, Santa would be cold and shut down peripherally. He'd be bradycardic and vasoconstricted, and he'd have a decreased cardiac output and decreased contractility and mean arterial pressure. As his temperature decreased, he'd have increased arrhythmias. So things like AF, initially on an ECG, he'd have increased PR, QT, and a widened QRS, and he might get J waves or Osborne waves if we did an ECG. Less than 28 degrees if he'd be at increased risk of VF. And if he did get very hypothermic, less than 20 degrees, he'd be likely progress to asystole. From a respiratory perspective, Santa would have a decreased respiratory rate and decreased minute volume, and his anatomical and physiological dead space would increase, and his oxygen hemoglobin dissociation curve would shift to the left. So he'd have reduced oxygen delivery. He'd also get hypoxic pulmonary vasoconstriction and have increased pulmonary vascular resistance. From a musculoskeletal point of view, he initially would be shivering, but then would be have increased tone. And a GIT perspective, he'd have reduced gastric motility, so wouldn't be able to digest all the Christmas cookies and things he's been eating. He'd have decreased hepatic metabolism, and he'd be at increased risk of pancreatitis. Hematologically, he'd have increased bleeding time and increased risk of venous thromboembolic disease. He'd also have platelet dysfunction and thrombocytopenia, and he'd be neutropenic and be immunosuppressed. And this is part of the reason that hypothermia is part of the triad of death for trauma. And from a genitourinary perspective, he'd have a decreased ability of his kidneys to handle glucose. He'd get glycosuria. He'd initially get a cold diuresis, but then be oliguric. And his concentrating ability of the kidneys would be decreased, and he'd have decreased blood flow to the kidneys and be at risk of acute renal failure. And then finally, from a metabolic perspective, he'd have a decreased metabolic rate, which decreases by about 6 to 7% for each degree decrease in core temperature. His basal metabolic rate might initially be increased when he's shivering, but would then decrease once he stopped shivering. And all enzymatic reactions would slow. So this means that drug actions prolong. So if we had to, for example, sedate him or we're trying to intubate him, he'd need much less amount of sedatives and neuromuscular blockade to be effective. He'd also be hypoglycemic because his endogenous insulin production would be decreased, and his gluconeogenesis and glycogenolysis would be increased due to increased catecholamines. So basically, he'd suffer a raft effects affecting each body system. So hopefully, he doesn't get on that wine and gets back to the North Pole safely.
That's great, Maddie. So obviously, that's quite interesting, Santa physiology. But obviously, Santa is immune from all these effects because, as Mike said, he never gets any side effects, and Santa magic works. So that's why he keeps surviving and he keeps traversing all over the world without getting much affected with all these temperature changes.
He does sometimes get into trouble, though. So I know while he was in the unit, he did need to have an enema. Do you know why he needed to have an enema?
Why?
He had bowels of holly.
Oh.
That's one to me.
Well done, Mike. It's like 3-2 now. Maddie, it's your turn.
Okay. I'm not really sure about this one, but we'll give it a go. So why did no one buy Rudolph or Prancer on Amazon?
Oh, they were too dear.
Yeah, you got it.
Okay.
Well done, Mike. So that's 3-3. Geez. Do you have a
Thank you,
decider for
Maddie.
this year, Mike?
Paul, a fear of Santa.
Oh, claustrophobia.
Yeah, very good. Claustrophobia. Claustrophobia. Very good.
Geez, this battle is intense. Well, that's a good way to finish 2021 because the scores are now leveled on 3 each. And we have to carry on this next year till we get a clear winner. So well done, Mike and Maddie. Any final thoughts for our audience?
No, just Merry Christmas and stay safe over the holidays.
Yes, and I'd like you all out there, if you are going to imbibe some alcohol to excess, make sure when you wake up the next day that you monitor when you start to feel better and how much more quickly you feel better after that, because that will be an insight into when you go from zero to first order kinetics in terms of your alcohol metabolism. And I think it's very important for all of our primary candidates to experience that sense of clearance of alcohol. It's one they'll always remember, and it's very important for our first part exam.
I like it. It's practical learning.
Exactly.
Absolutely. So thanks again, Mike, and thanks again, Maddie. And thanks to all listeners. Again, as Maddie said, wish you a very happy Christmas, happy festive season, and wish you a happy holidays. And also wish you a very happy New Year for 2020. And hopefully we'll see you again in January, and we'll continue this podcast till we finish our topics. So looking forward to see you again in 2022.
Thanks for listening. See you next time.
Merry Christmas. Happy New Year.